guys, welcome back to Medical Coding with Blue. Today's episode is all about alternative jobs for new medical coders. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so if you are out there looking for a job as a brand new medical coder, of course you are going to be running into a lot of places that want coders to have experience. Must have 3 to 5 years of experience, must have a year of experience. But how are you supposed to get experience if no one will hire you? They will hire you. However, what happens is a lot of times people get easily discouraged, and you can't do that when you're in this industry. In order to get in, you have to sometimes take a different approach. And if you're not listening to advice from me, as far as like applying with a temp agency, and the temp agency is not the staffing agencies that you see on LinkedIn, okay? I'm talking about Googling in your area, temporary agencies for medical professionals. A lot of times you'll see those come up and they will have, jobs or whatever, but these are temporary assignments. It's not going to be for a day, all right? It's going to be for like a few months or so. And that's usually how you can start to gain experience for your resume so that you can end up getting your long-term job. That's what I did. My first assignment was 3 months. My second assignment was about 8 months I was there, and then I made it to my forever home. But those 2 first jobs were through the temp agency. So like I say, there is no national brand that I recommend. It's just you going and looking at your local area so that you can find a temp agency near you. Now, sometimes you're not going to be able to start in coding, especially because if you're on a time crunch and you need a job right now, you may want to put out alternative positions that you can apply for. Now, these alternative positions today are going to use your skill as a coder in somehow, some way. So that way you don't lose things. You don't lose your knowledge. You don't lose your skill. You have that stimulus still around you with these jobs, okay? So when it comes to the jobs that you're going to have alternatively from coding, you want to make sure that the time you spend is going to be for something, okay? So the thing I will tell you guys is this: avoid positions like secretary or a scheduler or something like that. Now, secretary and scheduler receptionists are also very important to the whole healthcare cycle. However, it's not going to use your skill as a coder. And if they say, well, Blue, I got hired on as a receptionist and they said that they would let me select the codes and things like that, that's not coding. And also, they're trying to tap into your technical skill without paying you for that technical skill. Now, let's just talk about this for a second before I get into this. No one who has been technically trained in medical coding or even studied independently and been able to pass the certification exam, if you hold a certification, you should not be working for free, not even to collect the experience. Because if they're having you work for free, they can pay somebody to get in there and code and do all that stuff. So don't be working for these people for free. You keep going until you find a place that will hire you. And again, if you can't get hired as a medical coder just yet, then go ahead and try for these alternative positions. The first one that I want to talk about is medical billing. Now, some people will resist and say, I don't want to do billing. I am just giving these as alternative options for you. Please don't say that you're going to resist and all this other stuff like that. If you want to resist, that's fine. But at the same time, when you're telling other people, I can't find a job, and somebody's trying to help you, I'm just saying. So try medical billing. If the thing about medical billing is you don't have to be certified to be a medical biller. You don't even have to have a medical coding certification. So if you are presently in school and you want to start getting your feet wet and be looking into the industry and you want to start gaining some of that experience, apply for a medical biller position. So that way you could start getting that exposure. Because again, it's not asking you to be certified in medical coding or in medical billing. So it's a great way to familiarize yourself with the billing process. And then you'll have that to add to your resume, and that will get you, a lot more doors open than just spinning your wheels, okay? And the other great thing about medical billing is all of the knowledge that you'll gain on the billing side, as far as with the insurances, Medicare, Medicaid, and all these other things. So it's great, and you get to see the codes that are selected. You get to find out what the insurances are denying and why they're denying it, because you're right there on the front lines as the biller. So that's just something that you might want to consider. If you've come in from the real retail background, you might want to try medical billing first, because your retail background has a lot of transferable skill, handling money and keeping track and things like that of funds, even though it's on the retail side, it's inventory. But if you're counting a drawer, I mean, again, that is transferable to medical billing. And dealing with the public is also part of that too, because billers do have to work with the patients and resolving those bills that are outstanding. So that's something that you may want to think about if you are looking for an alternative position, something to get you going. And before you get too hung up on, oh, it's not going to pay me, it's not going to pay me, guys, you're only going to be in that spot temporarily. That's not going to be your forever home. All right, that's just for you to gain experience. So if you could just get your foot in somewhere, you can still continue to apply. It doesn't mean that you have to stay where you are. All right, the company's going to look out for its best interest, and the same thing as you, right? You got to be able to look out for your best interest. So that's the thing. It's business, guys. These employers know it, and you know it. All right. But it's just a matter of, you have this skill. How can we best start earning with this skill that we have now and we possess? Okay. So medical billing. Okay. The other one is prior authorizations. Now, prior authorizations is not coding, but it will expose you to the documentation, and it will expose you to dealing with the insurance company, and also that you will be seeing like the diagnoses and the procedures, and talking to the insurance company and saying the provider wants to do this procedure and the patient has this diagnosis, is this covered, yes or no? And so then if it's not, then there's a lot of back and forth with the doctor. So that's something that will get you experience. You having training in medical coding will help, because you'll be able to know if the documentation is going to support such a procedure. And that's you being able to advocate on the provider's behalf as well, because then you can point out by looking at the documentation, well, it's right here and that kind of thing. So again, it's something that you can use to build your skill. And not only that, you'll be making those connections there too, because these people who do prior authorizations often work like in hospitals and things like that. So and doctor's offices too. So again, it's a nice way to get connected in the industry. All right. So there's billing, there's prior authorizations, and then you have risk adjustment coding. I was going to say hierarchical condition category coding. Risk adjustment coding. So risk adjustment, you have to be very, very careful with risk adjustment coding. And when I say very careful, I mean that you need to be in risk adjustment for a short period of time. Risk adjustment is not a long-term job, in my opinion. Now, hold your horses, hold your fire, all right? What I'm saying is this: when you are coding for risk adjustment, it is just diagnosis coding only. While it is needed, and while all of the data that is collected is very, very important, what happens is you may end up losing your skill to code CPT, E&M, and apply modifiers and things like that. Now, if you say, well, Blue, I don't really want to do any of that anyway because I don't like all that stuff. A lot of people who say that end up getting bored with the risk adjustment job, because it is just the same kind of rigmarole over and over again. And you really do have to be strong in pathophysiology. Understanding the disease process and understanding pharma goes a long way to being successful in risk adjustment coding. So again, guys, I don't recommend it for long periods of time. If you want to use this to start with, just to get your feet going, and your foot in the door, and you're able to get that exposure to the electronic medical record, that's great, because that can be added to your skills list on your resume. And then you'll be working with, of course, the diagnosis and things like that. So working with the electronic medical record, working in the record, looking and abstracting diagnoses. Abstracting means that you're selecting the diagnoses, okay? It's not just auditing. Auditing records means like when you're not in the sense of like you're counting people wrong, but auditing is also referred to as when you're looking at codes that are selected and then you're verifying to make sure that the documentation supports those codes, right? So that's auditing as well. But that gets more skill onto your resume when it comes to coding. So, I mean, if you want to do that, I recommend 6 months, no more than 8 months. So that way you can get yourself going and you can start making some money and you could start continuing to apply for other places. And again, making those connections, all right? Now, here's another one that I think a lot of people overlook, because even I didn't think about this until I was with a client, and then I was just like, all of the things that this client, the skills that they were having, I was like, that you would be good for this type of position. So this position is a medical claims examiner or a medical claims auditor, one of the two. Their titles are interchangeable. But what this person is somebody who works on the dark side. So what this means is you're working for the insurance company, and that's what we coders like to call people who work on for the insurance company. They're working on the dark side. It's a term of endearment, really it is, because what we all do is we all ensure accuracy. We all ensure that everybody is paid appropriately, correctly, and that kind of thing. And that's what we do because that's our ethics. But with these medical claims examiners, I'm going to read this job description to you all. So that way you can see that there's other things that you can do with your medical coding training or with your medical coding certification that can take you in different directions, but still be able to use your technical skill. All right, so here we go. So this is for a medical claims examiner position, right? So the qualifications: 1+ year of experience in a role that required a focus on quality, including attention to detail, accuracy, and accountability of work. Does that sound like 1 year of coding experience to you? No, it doesn't. The second thing is 2+ years of using a computer with Windows applications that required you to use a keyboard, navigate multiple screens and computer systems, and learn new new software tools. I'm going to say medical. It's not medical, but it says learn new software tools. An education level of at least a high school diploma or a GED. So imagine that you go rolling up in there with your certification. Like they won't jump on you for that, right? Because you're going to understand what these codes are. Versus the person who's just coming in off the street and, yeah, I have 1 year of experience being accurate, in my other job. And that translates to like, okay, when you were working as a cashier, could you balance a drawer? Yes or no? You know what I'm saying? Or if you were a stocker, did you make sure that everything was stocked appropriately and that you kept inventory of everything? That's accuracy, okay? That's what they're looking for. They want somebody like that. And they have not mentioned anything yet about specifically coding, even though that's exactly what they're going to be exposed to, right? So the other thing is understanding of previous quality, production, and attendance parameters. That means you got to show up. They don't want people who are just going to be like, I don't want to show up today, because they have claims that they have to look at, and they have to look at them in a timely manner. So if you are the person that doesn't want to show up on Mondays, doesn't want to show up on Fridays, this job is not for you. But if you are somebody who is excited about applying your skills somehow, some way, about coding, this job, hello, So, and it goes on to say, understanding and adhering to work hours and leave policy, keyboard skills, and computer familiarity. You will be required to take a typing test during the pre-screening process. And guys, it's not that bad. It's not that bad. If you say, well, I'm not a fast typer. If you can text, You can type. Trust me. Let's see. It says, must be familiar with toggling back and forth between screens and navigating multiple systems. Most of us can do multitasking anyway. And even if you say, well, Blue, I'm not a multitasker, you got to get used to that, because that's exactly what medical coders do. I'm just saying. And then working knowledge of Microsoft products like Outlook, Microsoft Word, and Microsoft Excel. Hello. That's just like, these are just the basic skills, guys. And a lot of times if you say, well, Blue, I'm not really familiar with Excel or anything like that, if you check out your public library, a lot of times they have like these classes that you could go to for free or maybe low cost, and they'll cover these types of things. I have heard it from so many people who say, well, Blue, I didn't have any computer skills, but I went to my public library and they had a class. And I'm like, oh, well, that's fantastic. There's a lot of things that you can discover at the public library. People really need to go back to the public library. I'm just saying. Support your local library. All right. And then the responsibilities here. Listen to this. Processing of professional and hospital claim forms filed by provider. Reviewing the policies and benefits. Complying with company regulations regarding HIPAA, confidentiality, and PHI. Hello, what were you trained on and what were you tested on? HIPAA. So you're already qualified. You are more than qualified, right? And it says abide by the timelines to complete compliance training of NTT data/client. I think that's like an in-house thing that they have. Work independently to research, review, and act on claims. What do you do as a coder? What have I been after y'all on? To do your research. Learn to do your research. And that's exactly what it is asking for. The reason that I tell y'all things is because I want y'all to be prepared. But so many of y'all want to sit here and, oh no, I don't want to do this, I don't want to do that. Just go with it. Because I'm a veteran. And I've been telling you because I know that this is what the industry demands. So I'm just trying to do you guys a favor, just saying. And then it goes on to say, prioritize work and adjudicate claims as per turnaround time. Ensure claims are adjudicated as per client's defined workflows guidelines. So basically just follow the rules. That's exactly what it's saying. Sustaining and meeting the client productivity and quality targets to avoid penalties. Maintaining and sustaining quality scores above 98.5% and 99.75%. And guys, it's going to be based on how they do their quality. But if you're paying attention to detail, you should be right on track, okay? Timely response and resolution of claims received via emails as priority work. And then correctly calculate claims payable amount using applicable methodology and fee schedule. So it's not requiring you to learn how to do this complicated math, as I have told y'all before. These jobs, especially with billing, you have to know plus minus multiplication, some percentages, right? But a lot of times you're putting it into already these formulas, so you're just plugging in numbers and then it's doing the work that you don't have to really think about. It's basically doing it for you. It's calculating. You just have to put the right numbers in. That's it, you know? And then, of course, it talks about the benefits. But that's something that you can apply for. So that type of job is called medical claims examiner or medical claims auditor, all right? They're used interchangeably, all right? So that's just something that you can look at as an alternative. And I suggest these because sometimes I know that it's like a priority to get some money coming in. And if this is you, where it is you're in just dire need of just getting money to come in because you're behind on your rent, or you're behind on your car note or whatever, or even your house note. The thing about it is, guys, during this time that you're looking for a medical coding position, you can still be working. That's exactly what I did. I worked 2 and 3 jobs. And was it the funnest time to be able to look for a job? No. But when you're being told no a lot and you still have to put food on the table, you still have to be able to pay your bills, you know, sometimes you have to sacrifice a little bit of comfort and, you know, being able to do whatever you want because there's a greater goal at the end of the tunnel, right? So when you are out there and you're looking, you can still maintain your job. You can still be working at whatever until you keep applying so that you can get in somewhere. And again, you can apply to these alternative positions as well. And I'm telling y'all to continue to apply to these jobs that are asking for medical coders to have 3 to 5 years experience, because if happy coders are in that area, they're not going to move around. So that employer is going to be at the mercy of whoever applies, and you better be a good candidate so that way they have a reason to want to hire you. And again, if you can't get a job, or maybe you don't have a job, you were in school, you're trying to get a job, you're trying to do something, and you can't get in anywhere, then you need to look at your own skills. What skills do you have that you can use to help augment your money coming in while you're trying to find a job, right? So think about that. There's alternative things that you can do to kind of help you to boost your income while you're trying to find a job in medical coding. If you came from a background of another technical field like pharmacy, or any of those types of things, even nursing or something like that, look into doing tutoring. All right, there's always tutors that are needed for those technical jobs that you're trying to get away from, and maybe doing something like that may help you to, like, okay, I remember all of these things, and so you can be able to do those things and then still have some money coming in, so that way you can pay your bills and do what you need to do, so that way you can get your job. All right, it's not without hope, guys. I'm trying to give you guys some hope, because while the job hunting process is not the funnest, it does help you to develop as a professional. It does help you to develop, as a person too, because this is going to show you what you're made of, right? If you just accept defeat, and there's so many people that accept defeat right away. If you just accept defeat and just don't do anything, and you just say, oh, okay, well, I give up. I applied for 3 or 4 jobs and nobody called me because everybody wants experience, and so I just give up. Then you didn't want this bad enough. You have to want, being in this field of health information, you have to want it bad enough. This is what the field demands. It does. And yet, are there other fields that are a little bit easier to get into? Probably. But I don't know anything about those. All I know is about this field. And all I know is all the benefits and the rewards that come from being in the health information field. And I love it. I'm always growing. I have this wonderful audience that grows right along with me. And I'm just here just to try to help you guys to look at it from a different point of view. Don't look at it as constant defeat. And don't get into your own head about it. It is not personal. It is not personal when they won't hire you. What they're thinking of is, these schools pumping out these people and saying, oh yeah, you can be a medical coder and we'll teach you how to pass the certification exam. But they don't teach them the fundamental basics of coding. And the person has not, learned that they've got to be able to teach themselves too. And so a lot of times what happens is these employers are like, well, I don't want to hire somebody that I'm going to have to train from the ground up and then they're just going to leave. Or I don't want to have to train somebody because we have this budget for somebody who has experience and who has the knowledge. And I don't want to give this to somebody who is not, really going to be into it. They just want to show up for a check. And so again, that all plays into it. It's a business thing, guys. It's not personal. It's business. So that is the reason why you have to have a good resume, a good cover letter, and it cannot sound like, oh, well, like everybody else. Oh, I'm looking for an entry-level job. If you have entry-level anywhere on your resume or cover letter, get it off of there. Because if I'm a hiring manager and I see somebody trying to stroll up in there and say, oh, well, I'm looking for an entry-level, I'm going to immediately reject that resume. Why? Because that's somebody that needs their hand held. And that's exactly how these employers are looking at it. They know you don't have experience. Let's not point that out. All right? Let's talk about our skills. Let's talk about the things that we know. And yes, you don't know what you don't know. However, you can study. You can be reading the coding guidelines, because that is within your control to read those coding guidelines. And while it may not make sense right now, when you get in the real world, it's going to start clicking. It will start clicking. And if you're taking part in my medical coder challenge this month for October, where you're reading the coding guidelines, the 2024 ICD-10 CM coding guidelines once per week, 4 times. 1, 2, 3, 4. For 1 week, you're reading the coding guidelines. Next week, and the next week. So you're reading it a total of 4 times in the month of October. Not 4 times a week, but 4 times in the month of October. That is the challenge. And by the time the end of the month gets here, you are going to be so well versed in those guidelines. You don't have to memorize them. You just want to get familiar with them. Okay. And that's the goal, guys. That is the goal, because a lot of coders don't do it. A lot of coders do not read the coding guidelines. But I'm encouraging my audience to read the coding guidelines because I want strong coders. I want coders that are going to be like, yes, I've been reading the coding guidelines, because those employers may ask you questions about that, because that's where they know they can trip a lot of people up. But if you go in there and you say, oh yes, well, I've been taking a part in this challenge and I've been reading those coding guidelines, so bring it on. Maybe not saying bring it on, but hey, that you're ready. That's the spirit. That's the way to go. I'm just saying. So if this video helped you, I'm going to wrap this up because I'm about to run out of time. But if this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.